Well, what happens if you get in an automobile accident and you just smash up the nose and it's all crooked? How do you fix it?
Well, ideally, you'd like to fix it very soon after the accident. So
Within a month or within a week or within a day?
actually, within the first week. Ideally, we'd like to, the first, when you get in the accident, hopefully the ER would call up and say, hey, I've got somebody here with a broken nose, and come right down there and
What do you
and
do?
fix it. I take that person to the operating room that night, and they're going to need to go to sleep, and they're going to have to straighten their nose.
So how do you straighten it? Do you have to re-break it then, I guess?
You shouldn't have to re-break it in that initial period. What you should mostly have to do is basically find out what's wrong, whether or not the septum is deviated. And the septum, which is that cartilage portion that sits right in the middle, it sits in a little groove, and it sits in that bony groove. And if you break your nose, it can actually come off of that groove and give you a tilted appearance. All right. So you have to go in and basically put the septum back into the little groove that it sits in, and then you have to set the nasal bones, and you have to put in a splint, which is basically like a cast for the nose.
How long would that take to heal?
You leave the splints in for about a week.
Are they on the outside or the inside of the nose?
Both.
Both on the outside and the inside?
Both on the outside and the inside.
And when you have the opportunity to really refix that nose, look pretty good 2 weeks later?
It will take, you're going to have some swelling, but it will look good.